Hi, it's Jenny with Life's a Polyp, and I really debated over making this video or not. I wanted to talk about why I refuse to have upper and lower scopes, specifically lower scopes, for probably close to 10 years after my diagnosis. Now, it is not something I recommend, and I'm not a doctor, so don't take medical advice from me. Always talk to your doctors. I just wanted to share my experience. So I did scopes for a long time, starting when I was 8. And my pediatric GI specialist, she always wanted me to do the prep, even when I didn't have a colon anymore and I had short bowel syndrome, because I'm also missing part of my small intestine. And as many of you know, the prep can be awful. It's improved a lot from when I was a kid, but it was excruciating for me. In high school, after I had my ostomy reversal, I was going to the bathroom so often that she described my skin as raw hamburger meat. So you can imagine what the prep did to my skin in that condition. And she didn't let me not do the prep. So I ended up refusing, when I became an adult, to do a scope. And it wasn't until my hospitalization in 2015 when I was transitioning to an adult doctor, because I'd been with my pediatric GI specialist for 20 years and I was about 30, and it was time to go to an adult doctor, and she was retiring anyway. And my new GI doctor told me that I didn't have to do a prep, and he worried that with a prep that it would irritate and inflame my intestine because I have short bowel syndrome, and it would make it hard to determine what was real and what wasn't. So he doesn't make me do a prep, and so I will happily do a scope now. But I also didn't talk to my pediatric GI specialist about other options of prep. Now, I would have been fine fasting for a few days, and I know there aren't as many prep options back then as there is now, but I should have talked to her about that more openly and been more open to that possibility with her, because it is against medical advice to skip your scopes when you have familial adenomatous polyposis. It's very risky to do that. I was fortunate that I didn't really have many polyps develop in the meantime, but that's not the case for everyone. And as we know, our polyps can turn cancerous before we even know it. Now, one of the reasons why I was okay skipping scopes and taking that risk is because I personally would not likely do chemo or radiation if it was recommended to me. Now, most people would probably do it, and that's perfectly fine. That is an individual choice, and I'm not trying to persuade anybody to not do medical treatment for anything. Again, it's something to talk with your doctors about if that's what they're recommending, to see what your options are and what you feel comfortable with. I just wanted to share my reasons for why I skipped scopes for so many years, because it has come up in conversation online and in my blog, and I hadn't never really explained it. So that's my story, but I do my scopes now whenever my doctor recommends them. And so far so good with them, but I'll continue doing them. Thanks for listening. Thanks for watching. Be sure to check out Life's a Polyp blog and shop, and subscribe and like, and I'll talk to you soon.